Welcome back. In this video we're going to talk about knee pain. What we're going to give you for knee pain to do is going to be fairly simple, in part because a lot of the knee pain that we run into is really coming from either the ankle and foot or is coming up from the hip and above, really usually above the knee. But it means that we're going to give you some specific homework for knee stuff that's kind of local to the knee or helping the knee, but generally anyone that's having knee specific stuff actually around the joint itself, not far above it, not below it, but the knee itself. Outside of the homework, I'd still suggest you go to our foot, ankle, shin, calf video and work on some of that, and go to the hip, back video and do some of that, especially if you're having IT band issues. We're going to talk about that in the hip back video, just because it's more of a hip issue than it is a knee issue. So we're going to jump over to our body model, but go ahead and make sure to check out those two other videos as well. And as usual, boilerplate video below, you should be familiar with that now if you've gone through these. Check that out for more of an explanation about what I do and how these skill sets work, because I'm not going to explain a whole lot of that as we go. And the usual repetitive disclaimer of, if you suspect you have an injury, if you have some condition that makes you think you shouldn't be doing this, especially say blood clotting issues or other circulatory stuff, don't do this. See a practitioner. And if you're not seeing some good improvement within the first week or so, or you're having any worrying increase of symptoms, whether that's different symptoms that are worrying that you're not used to, or your usual symptoms getting way worse in the first few days, then discontinue this. It just didn't fit for your issues, since this is, well, I'm getting to give you some options from afar without actually assessing your situation, so it just might not be appropriate. So let's jump over and see what we can do for you folk. Okay, so similar to how we did the foot and ankle stuff, the knee stuff, as I mentioned a minute ago, most of the time you're going to be wanting to do the ankle, knee, shin, etc., as well as the hip stuff. But there are a few localized things that we'd actually have you work on the knee. Just three structures generally. So not directly on the outside, but kind of 2/3 rather. Words are hard. Right around here on the knee, there's your MCL, so your medial collateral ligament if you're dying to know, and your LCL, lateral collateral ligament, just a fancy way of saying it. There's one on each side. And those we'd have you gently work on, and they go between your shin bone, the tibia, and your femur, the leg bone. And so it's just a band that goes in between. So if you were kind of around the middle of the kneecap, maybe a little bit lower, and you were starting to push your way out, you'd come into this band where you're like, oh, okay, there's something soft that I'm kind of running into. And so we'd have you just with a finger, gently, and as with all of our releases, nice and slow, work on that kind of in the gap between the bones and gently on the bones themselves. It's going to be, maybe the size of your pinky, maybe a little bit smaller. And so just take a finger through, again slow, maybe about a minute or so on each, around the attachment and in between. And if you're having a hard time feeling it, I'll just kind of go in between the bend and see where I can find that band. But really, if you just go kind of the bottom third to half of the kneecap and work your way out, you should run into that gap and that band going between it. So pretty close to the middle of the outside, but a little bit more biased forward. And again, on both sides, inside and out. The other one is simpler and more complicated at the same time. So as I was talking about in the foot ankle video, we tend to think of the shin as just this like really thin thing, but it's a little bit wider than you'd really think. You just don't really poke it a whole lot, but as you come up, it goes into a shelf and actually gets fairly wide as a place for the leg to actually settle into. So where that's the height of the shin bone, as we go up, you see it gets wider and wider and makes this whole shelf. Just underneath that shelf on the inside, similar to how we're working on this for the ankle, foot, etc. video, you're wanting to try to kind of scoot behind the shin bone, but at the very top, below that widening shelf, and just gently kind of scoop backwards like that. This is often very tender, and this is one of those ones where if you had clotting issues, any circulatory stuff, it's close enough to some veins and arteries that I wouldn't want you to go nuts. especially because it is going to be pretty tender. But you're not just going back, you're kind of going up. Because the muscle we're talking about is right on the bottom underside of the shelf, kind of on the back, but we get to work on it a bit from the front. The popliteus, if you want to actually go look at pictures, that makes this a little bit easier. I'll actually show a picture of it after these demonstrations and a few other structures, so that it's not just me trying to loosely explain it without you actually being able to see it. But scoot through back, again, be nice and gentle with that, otherwise, well, you'd be saying mean things at me and I'll never hear them, so it won't help you at all. So our exercises for the knee issues and the knee homework is going to be really simple. I do want to add, this doesn't include the IT band stuff, which is going to be in the IT band back hip video. And if you do have some knee issues, those should probably be done together anyway. If you have IT band issues, you might want to do both anyway. When it just comes to the knee exercise, once you've done the releases, we're simply going to do a standing leg raise to a curl. That's it. First time you get fatigue in one of these portions, you drop that. So say this gets tired, you stop, you just do the leg raise. Leg raise gets tired, you just do that portion. First fatigue, cut it off. Fatigue on the other side, stop both. That's it. So, knee stuff dealt with. I know I'm being repetitive, but a lot of the knee issues, you're going to be ankle and hip back as well, so go ahead and check out those videos and just be thorough, especially if you're on trail and doing, 20, 40 miles a day. So I am going to be on trail in about 2 months, so I have very limited time to answer questions, but I'm happy to do so while I can. Otherwise, there are other videos waiting for you. There's going to be some more out shortly. So like, subscribe, and take a look. We'll have some more stuff out there for you very soon.